So now I'd like to quickly introduce our presenters. Annie Picard is the Innu Roundtable Secretariat Health Coordinator in Labrador. She lives and works in Sheshatshiu Innu First Nation and speaks Innu, Aimun, English, and some French. In her role as the health coordinator for the IRT Secretariat, she is responsible for supporting health planning in both Sheshatshiu Innu First Nation and Nuatchit Innu First Nations, working with multiple levels of local, regional, provincial, and federal governments, collaborating and overseeing health projects and initiatives, including research, and applying for funds to support priorities for the Innu. Dr. Melody Morton-Ninonga is a settler of Japanese and Swiss-German Mennonite descent, assistant professor and in the health science department at Wilfrid Laurier University, and Canada Research Chair in Community-Driven Knowledge Mobilization and Pathways to Wellness. She co-leads a variety of First Nations community-driven health and wellness research projects and is involved in national and regional working groups and advisory teams on Indigenous-focused projects related to fetal alcohol spectrum disorder, Indigenous evaluation frameworks, and principles. Melody and Annie have worked together on multiple initiatives over the last 10 plus years. One of them is this project that they will present to us today. So without further ado, I'm glad to pass it to both of you.
Awesome, thank you. I'm ready to share my screen. Okay. Annie, I'm going to hand it over to you in a moment, but I was just going to briefly state sort of the arc of our presentation for today, and then Annie will start us off. Just to reiterate, I think most of you might have seen the short description, and then Anna kindly just reviewed it. The way in which we've organized our presentation is Annie's going to share the background history and impetus, like how this project even came to be. And then I'll describe some of the activities that happened during the project and things that came out of it. And then Annie will proceed to describe like how the FASD prevention strategy pieces are fitting into current and future work. That's how we've structured it. So without further ado, Annie.
Hi, thank you for the invitation. During the introduction, my name is Annie Picard. I live in Labrador, the big land part. We, the Indigenous people, call our land Nitisinan. So I was raised here. I also came to live here in Sheshatshiu in 1980. So I've been here most of my life. My family on my father's side is from Quebec. I've been working with IRT for about, just going to be my 6th year now, Roundtable Secretariat. And I guess that's where I want to begin our presentation, is talk about how I got involved in it from the beginning. Before I started working with Roundtable Secretariat, I started working at the another organization within our community called the Mary May Healing Center. So that's the addictions and social health and stuff that they oversee for our community. So I was over there working, and I was the FASD coordinator over there. And so that's how I got involved in the beginning, and that's how I met the Melody, is through that work. So I worked in that position for a number of years, and then I got a position here at the Roundtable Secretariat, and as the health coordinator. So I guess to begin, I'd like to just give a brief background about the Innu of the health work that's been happening here. So a number of years ago, the Innu, I think the Innu became a reservation in 2002. So before that, the Innu people of Labrador were considered as part of the rest of the communities here in Labrador. And in 2002, when we became a reserve, we were able to get funding from the federal and provincial government. And it was through that funding, one of the criteria was we had to have a health board. So the Labrador Health Secretariat was then created for that. Unfortunately, the Labrador Health Secretariat was run by non-Indigenous people. And so it was, after a number of years, there's a lot of frustration because a lot of work wasn't moving forward under that health board. And our leaders, our health directors and our managers, coordinators, and that we used to go to these meetings, and it was just, nothing was moving forward. So I think it was in 2009, they finally said, nothing is moving forward. I think it's best for us to just leave the table. And so they left that table. And then in 2012, our leaders said to the federal and government, we still need these services. We still need work to be done within our community. And then they said, take the money that you funded for this Labrador Health Secretariat, take that money and give it to the Innu. Let the Innu decide how they're going to run their health services. So in 2014, that was approved, and the Innu, the Labrador Health Secretariat was dissolved, and then they established the Innu Roundtable Secretariat. It is all Innu run, and under that is where we created the health committees. So under the IRT, we have the Innu Mananian Committee, which is a committee overseeing a number of other subcommittees. So when there's 5 subcommittees under that, and there was health information management, FASD, maternal child health, and health and addictions, and diabetes. So those are the 5 priorities that the Innu people felt were very important to combat. And it was because of that that I got involved in the FASD work. And when I left my position at the Mary May Healing Center, I still wanted to keep working with FASD because I've been working with it for so long, and I didn't want that work to get forgotten. So that was one of my I guess I wanted to make sure that when I started to work for IRT, that I still wanted to continue the work that I was doing. A lot of things changed, of course, but I was still able to do the work that I was doing for FASD. So, And it was in the FASD working group that one of the requirements under the IRT was every committee needed to have a work plan or an action work plan. And FASD, under FASD, we created that work plan, and that's how we had to continue to work with Melody.
Are you going to pause here, Annie? Or do you want me
Yeah.
to take us to the next?
Yeah, you can go to the next one.
slide?
So every working groups had to come up with an action plan. And this is I think this is just the first page of the FASD one. So
Yeah.
this is what they look like. And I think I'll pass it over to you now.
Okay, thanks, Annie.
Yeah.
So I'm wondering if we could just pause for a moment, because I was going to say a little bit about myself just to situate my relationship with Annie and also one of the two Innu communities. So I'll come back to this slide if that's okay. I had a brief introductory slide. I'm recycling something that I've used for different purposes, but I think the main thing I want to highlight here is I do come from a double, like a bicultural background, raised in Japan, and then as an adult moved back to Canada where my mother's roots are. But also to highlight that I'm also a parent to a child from that's a member of Mushuau Innu First Nation. And so I have personal connections by extension of her that is long-term. And so my connection with Mushuau Innu is different than it's personal, and it's not just about working on projects. So I think I'll just leave it at that. So yeah, so and just one comment to add around this action plan. This is the first page, so it might be interesting to know that one of the 10 action items was also thinking about like what is Innu parenting. So there is a wide range of different recommendations. The one that we're talking about today is not on the slide. It was a different recommendation, and it was specifically to develop an Innu specific FASD prevention strategy. But there were 10 recommendations. Some of them were relatively smaller in time frame to accomplish, and others were bigger. So I think developing the prevention plan was among the bigger items. So to do the FASD prevention work, we did apply for some funding to support it. And in the end, it was funded by the Health Systems Integration Fund. I think I sometimes worry I'm saying it's the wrong thing, systems or services. I'll double check, it's in my notes in a different slide. But just to say, one of the things that we did do around this project was make sure that we had a governance structure that worked practically and ethically. So what we did have is what we called the core project team. So that includes like Annie and myself, but it also included the FASD liaisons for Sheshatshiu and Mushuau Innu. So Juliana is in Sheshatshiu, Martine is from Natwashish, Annie, myself, June Fry, who has just recently retired, Nancy Poole, who some of you would know or have heard of, as well as Lindsay Wolfson, who I think is on the call. So we were sort of the core team that were doing the work of the project. And then there was also a larger group of people, so approximately 30 people here, who are people who live and work in the two First Nations. And their main role was to participate in bigger group meetings and offer input, insight, and support as needed throughout. But then we also had a couple of people that fall into this blue circle, which we called the health system stakeholders, who are in essence people who work within government, like health organizations. And their role was not as much to guide the work, but be informed of the work, be ambassadors within their own networks, and be able to support as needed and as able throughout the project. And here's just a picture. I thought it's nice to always see faces when we're talking about projects. So this is a picture taken at one of the health forums that Annie organizes as the IRT health coordinator. And a lot of the people that would have come to previous meetings as part of the engaged stakeholders, I would call rights holders now, people within both First Nations are represented in this picture. You see Annie right, maybe Annie's right in the middle. I'm over to the side. Juliana next to me to the right is the FASD liaison and Sheshatshiu, and Martine Nui right here. I don't know if you can see my cursor. Can you? When I'm maybe not. Martine is wearing a gray light shirt, just a bit left and above Annie there. Some of you might spot Nancy, and I think Lindsay took this picture possibly. Okay. Oh, here we go. So what I'd like to do is walk through 4 key components to the work that we articulated in the process of developing the strategy. The first one was to talk to people who may have been supporting FASD prevention at any level. So by that, referring to the multiple sort of levels of FASD type prevention. And to do that, we made a pretty comprehensive list of people in both communities to reach out to. And we hired someone on the ground locally to conduct the interviews so that the interviews could be done in Innu or English. Some were done in a combination of both. And I know Annie ended up helping with a number of interviews, and Lindsay, who's on the call, was also quite involved in talking to people and having recorded conversations or interviews. Sorry, I didn't remember that these were animated. I'm going to get to 2, 3, and 4, so just disregard those for now. So in relation to that thing, that portion that of interviewing people in both communities, these aren't the precise questions, but just to give you a sense of the types of questions that were asked were largely around, you know, what kind of services are available, just to get a sense of like, who are you working with that specifically work with girls and women that might in any way be talking about or helping to support reducing substance use. Addressing, so we were trying to like branch out and think broadly in terms of thinking about housing, nutrition, financial support. We also used the prevention levels in both Innu and English, just for people to appreciate that we're not talking about FASD prevention in a very narrow kind of way. And just appreciate what kinds of programs currently exist and how might we be able to work together better to support women, girls, and other networks. And in doing so, right now. Okay, so that work happened of gathering the information, but then Lindsay, who's on the call, did a lot of work around then mapping not only the information that was gathered, but also mapping the actual supports that exist in the community. So I don't expect people to be able to make out all of the words, but I just want to have people appreciate that there were a lot of different organizations or programs or positions that do work And these lines are indicating how they might be collaborating or working with or sharing information with people in other programs to see who is working together, who is not, where are some of the places where collaboration could be happening but isn't. And maybe there's collaboration happening and we just hadn't really appreciated that. So there was some mapping that happened that we shared and discussed as a group. The third component was looking at what others were doing in First Nation contexts. And I think we had almost gone to Cold Lake. There were different ideas on the table. And in the end, we ended up doing more of an Atlantic tour. And I have a picture in the next slide here. So on our Atlantic tour, Annie is, you can see in the bottom left-hand corner picture, there's Annie, there's myself, June in the middle, and Seraphine in the black jacket was one of the people we hired to work on the project. And some of you might recognize these faces. The bottom left-hand corner was a picture taken at the New Brunswick FASD Center of Excellence, where we heard more about the Dreamcatcher model, where they do culture-led wraparound supports for individuals and families being assessed for FASD. We also went to Elsipogtog First Nation and got a really nice tour and explanation of their different types of FASD programming, learn more about their diagnostic assessment program, and also how they work and link it to a lot of their prevention and initiatives and support in the community, because they in many ways have a very integrated approach in that First Nation. And then we went to Lennox Island First Nation on PEI to learn more about their multidisciplinary teams and their home visiting program. So after doing all three of these components, we held a number of online informal type presentation / discussion. So I don't know about people on the call, but I know, and Annie knows very well too, like Facebook is probably among the easiest ways to connect with people, communicate. And so we held this through, like a messenger video call? Like we just invite people to join through Messenger and shared some of the key findings from those three components. So like, what did we find from the interviews? What did we find from the asset mapping of the different programs and services and positions? And then also some of the key findings from each of the communities, and discussed it. So I think we had 2 or 3 of these, Annie. In this moment, I cannot remember, but we would have gone to all of them. So we had that. And this was, like you can see, it's November here. So I think we were working towards doing some more work in relation to the timing of COVID. And so we weren't able to do in-person things to follow up on this project specifically. So we've been mostly communicating virtually. The next few slides are highlighting some of the key findings from Sheshatshiu and Natwashish. So I don't think people should feel like they need to read everything on this slide. I just wanted to give a sense and an couple examples of things that were found. So just one of the commitments of this project was to use like a strengths, like appreciating the things that are already happening in the community, what people are already doing well. And sometimes people don't even, well, oftentimes people don't even see their work as FASD prevention, but highlighting how it is in some ways, and could be collaborating across the community, but also for the FASD coordinator, liaison person, to be able to appreciate too the ways in which their work is sort of spread out across the community. Some of the successes that were highlighted in the interviews were things like high graduation rates after going to treatment, community support in general to reduce substances, and certainly some culture and virtues-based programming. Some challenges that would span across both communities, though, are like lack of human resources, so staff or people to work in certain areas. And CSSD, I wouldn't expect you to know, and now the Innu are really working towards self-governance around care and for their children. So I think it's called the Innu care approach, but needless to say, child welfare in Newfoundland and Labrador uses the acronym of CSSD, so fear of child welfare, interference, and involvement. And then in terms of opportunities for advancing FASD prevention, a lot of things were mentioned, including making better use of Facebook, doing more culture-based activities, including elders, case conferencing, of which a lot of that is actually already happening and happening more so, and posters and different kinds of materials that could be disseminated widely throughout the community. And in Natwashish, or Mushuau Innu First Nation, some similar things, but even though they're both Innu, the only two Innu First Nation communities in Labrador, there are differences. And so we didn't want to lump both communities together. So for the Mushuau Innu, we have some related things, but just to highlight that, yeah, there's been a movement to have multiple expeditions with girls and women going out into the land for at least a week. Annie's done one of them. And so just highlighting that girls and women's programming can include FASD, but without having an explicit FASD focus. So the women and girls walk in the country for a week or so might be an opportunity to have some of those rich conversations around pregnancies, families, relationships, etc., in which a lot of the FASD prevention type conversations could be happening, but also fostering good mentorship and relationships that could last a lifetime. And in the middle, highlighting that there just is not enough tailored programming to support individuals with FASD, and feeling isolated, and again, feeling fearful of child welfare involvement. And opportunities would include things like more education and workshops on FASD for staff in the community, particularly staff that might have a high turnover rate. So teachers are included in that list, and building stronger and new partnerships across different sectors. And I just threw in a couple examples here. So if you remember in an earlier slide, posters was mentioned in Sheshatshiu as something that people saw as something that they would like to see happen. So they're in the midst of being translated. That's why the Innu is the same in all posters, because they're just a placeholder. They need to be translated. But we've commissioned photographs within the community and have messaging that will be in Innu and in the red in English, with messages like healthy pregnancy, healthy baby, healthy nation, etc. So these posters will be disseminated in the early new year. We are also working on a different type of poster. You're only looking at a small window of the poster, but this is a different take on, you know, that slide where there are the bubbles and all the lines, the network slide. This is meant to not be a little less overwhelming with connections, but what this is here is a spruce tree that highlights through the life cycle, so starting with children and then youth, adults, and parents, the different types of FASD prevention programs or services that are existing in the community. And the roots of the tree highlight some of the, we have Innu Roundtable Secretariat where Annie works, the First Nation governance, the Provincial Health Authority, etc., as things that feed into in terms of resources to support these programs. So this one's from Mushuau Innu First Nation, and we're just reminding people that FASD prevention comes and looks in different forms. And so this is meant to be a long poster that will be shared in the community, but is meant for anyone to be able to use, including service and program workers. And so the top half will have the image on the left with the tree and the sun, and the bottom half will be a list of all of the different programs and services with a brief description like the one you see on the right. So a few bullets of what they have to offer. What's not showing here is we'll also have a phone number for people to call and the location where it's held. So it would be like an asset map that's just tall and skinny that will be widely disseminated. And there's a different one for Mushuau Innu First Nation as for Sheshatshiu, because the programs, some of them are the same, but quite a few are different. I hope this pace is okay. So Annie, we have 2 slides left, and I'm wondering if you're able to speak to this one in terms of segueing into, so we did this project, but it aligned with the development of a comprehensive capacity development framework that is very much part of Annie's work.
Yeah. So one of the challenges, I guess, I was facing when it came to a lot of the work that I have to do, I had to develop like funding, request funding every year. The word escapes me right now. But I had to send in a request for funding every year. So every year I would send in this to the government, and then it took maybe sometimes about 3-6 months to get an answer if it was approved or not. So then I would get the an answer, and then I would have to start my work, which is like a year of work would have to be in 6 months. So that was very challenging for me. So I suggested that maybe we should look at a more comprehensive capacity development framework. And they said, okay, let's do that. Because I told them, like, I'm wasting a lot of time, and the work that we could be doing in our community basically was just proposal writing. And so they said, okay, let's try it that way. So we suggested a 5-year plan, and that involved writing a big proposal and planning out the next 5 years. And then also that meant that I had to look at different priority areas for the Innu people. So what we did was we looked through all the reports over the years, the past couple of years that came out, and we looked through all of them, and we looked at what are the common things that kept popping up. And I think we went through 94 reports or something, or 97 reports on health. And these are the 7 priorities that kept popping up in that. So we decided that these are what we're going to be working on in the next 5 years. So as you can see, we had a governance, food security. Food security is very important, especially for the Mushuau Innu First Nation, who are very isolated. There's no road that is going there, so you have to get your food in there during the summertime by boat or fly in food. So that's why this was very important. Capacity development, there was a lot of stuff that they talked about, like we need more people that are trained in different areas to work in the community. Data collection, alcohol and drugs, addictions, and I have diabetes and the youth services. So this is what the 5-year plan looks like for us. And we're using this, we're going to be using this in those working groups that I was talking about earlier under those health committees. So this is the work plans that they're going to be using for those health committees. So the other thing too that came up is that I remembered we had the FASD action plan also, the prevention work that we had done. And I didn't want any of that work to get lost in all this big project. So I talked to Melody and said, look, can we just look at it and see if we can implement this and like figure out where the FASD work could fit into all this big initiative. And so this is what we did.
Mhm. Yeah, and I feel like I hid the slide, but I remember looking at this, and one of the things we did was identify where in each of these areas the FASD prevention recommendations could fit into these different priority areas. And then I don't know, Annie, this is like something you shared in anticipation of our presentation today. You're reinstating the working groups. Is there anything on here that
Yeah.
you want to highlight or not really?
So during COVID, what happened was those health working groups, they kind of like came to a stall. Everything closed down, obviously, and we couldn't meet in person, and people didn't want to meet on like Zoom, and that they weren't very comfortable using computers and that. So it was hard to get people to keep meeting. So all our meetings stopped for like 2 years. And then in the spring of this year, our leadership, the chief and councils of both communities said that, okay, you got to get these working groups meeting again. So we had to reestablish these working groups, and so some things have changed since the last time they met. We had to, like, there's a lot of people that have moved, membership that's changed, people that have moved away from their positions, and so it was almost like starting from the beginning again. But we had something to guide us.
Thanks, Annie. So I think that wraps up what we had prepared to share today, but I think we've left 15 minutes for discussion or dialogue. I can stop screen sharing too, so we can be bigger on the screen.
Thank you. Thank you so much for sharing with us this fantastic project that you did this work.